where your body stops either producing insulin or can't use the insulin effectively, and then you end up with high blood sugar. So its actual definition is it's a chronic health condition, and it affects the pancreas. The pancreas is the organ in your body that secretes insulin, and the insulin is what helps your body use glucose as energy. And as I mentioned just now with diabetes, you either have insufficient insulin or none at all, or your body cannot use insulin well, which is called insulin resistance. And yes, it results in too much glucose in the bloodstream, and there is currently no cure. And we may also know already that there are several different types of diabetes. The first one is type 1, which is actually an autoimmune disorder. The cause is unknown, although some people, it is believed that there is a genetic component, and this autoimmune reaction actually prevents the body from producing insulin. It often presents in childhood and young adults, although it can present in adulthood as well, and it requires taking insulin daily, or as the doctor prescribes. Type 2 diabetes, or otherwise known as lifestyle diabetes, is when your body becomes unable to use insulin effectively, and 95% of people with diabetes have type 2 diabetes. It's largely the result of excess body weight and physical inactivity. There is another condition related to diabetes called pre-diabetes, and this is when your sugar levels aren't quite high enough to be just diagnosed as diabetes, but it's higher than normal. And pre-diabetes is a risk factor for type 2 diabetes, heart disease, and stroke. And the body cells do not respond normally to insulin, resulting in the pancreas producing more. Obviously, this is not a good thing, because then you would be overworking your pancreas, and eventually it would progress into type 2 diabetes. So let's look at some of the symptoms associated with diabetes. Obviously, depending on the type of diabetes you have, the symptoms may vary. So these symptoms are more on the general side. So these are ones I think some of us may have heard of before, things like frequent urination, often at night, constant thirstiness, sudden weight loss, intense hunger, blurry vision, numbness or tingling of the hands or feet, immense tiredness, very dry skin, slow wound healing, more infections than usual, and type 1 diabetes may have symptoms such as nausea, vomiting, and or stomach pains. So now that we know what diabetes is and some different types, some of the common symptoms, what are some complications that come with diabetes? Because while diabetes is a so-called, you can live with diabetes, if you can avoid getting it, it's better, because there are some complications that diabetes can actually have a big impact on, especially in terms of your quality of life. So the first complication is hypoglycemia. This is when your blood sugar is too low, and this can result in things like weakness or shaking, sweating, increased heart rate, dizziness, confusion, numbness in the mouth or tongue, blurred vision, headaches or seizures. And if not managed or attended to as soon as you realize that you have hypoglycemia, it can result in the loss of consciousness. So basically you could actually faint, which is really dangerous. Another complication is neuropathy, which is nerve damage. So with diabetes, the nerves, especially, it usually starts from your peripheral body, so your hands and your feet, and then your nerves will start to become damaged. And when this happens, if you get injured, you may not notice this. And as I mentioned earlier, one of the symptoms of diabetes is that you may have poor wound healing. So if you do not notice a wound on your hand or your feet, then that wound does not heal, it doesn't receive any treatment, and it could actually progress into something much worse. It could progress into a diabetic wound, which sometimes can also result in amputation, but we'll get into that later. Okay, so another complication is our skin complications, so things like bacterial infections, fungal infections, and itching. So basically, when you have diabetes, your ability to fight off infections is impaired. Another complication are eye complications. Having diabetes puts you at a higher risk of developing glaucoma and cataracts. You can have foot complications, as I mentioned earlier with neuropathy. Foot complications can result in nerve damage, can cause symptoms such as tingling, pain, weakness, poor blood flow, or loss of feeling. And as well as another complication is nephropathy, which is kidney disease. So it affects your kidney and affects its function to actually filter and clean the blood in your body. And when this happens, as we know, as I mentioned, kidney filters the blood in the body. It's made up of millions of tiny blood vessels, and they remove waste products. Diabetes can damage the kidneys, by causing it to filter out too much blood, and the kidneys end up being overworked, and this can cause them to start leaking proteins into the urine. And finally, if not treated or not diagnosed, it can actually lead to kidney failure, which is very dangerous, because once you reach kidney failure, the only way to treat, in a way, is to have a kidney transplant, or if there's none available, then you would need to have regular dialysis, which is basically where the doctors would hook you up to a machine that would help you clean the blood instead of your kidneys, right? Another complication is cardiovascular disease. Having diabetes increases your risk of developing it. Basically, anything to do with your heart. Things like atherosclerosis, so buildup of cholesterol in your arteries, heart failure, and arrhythmias, which is an irregular heartbeat. It can also put you at higher risk of high blood pressure, also known as hypertension, as well as stroke, which is the interruption of blood supply to your brain. So if you have diabetes, you may be at 1.5 times higher risk to have a stroke, which is not great, because anything to do with the brain will obviously affect the rest of your body if you ever do have a stroke. So what are some basic treatments of diabetes? So for type 1, preface that, these are just the super basic treatments of diabetes. If you do have diabetes, or if you have a family member, or if you're concerned about it, definitely consult your doctor or a doctor specializing in this disease, so that you get the best treatment and information possible. So back into the treatment. So for type 1, as I mentioned earlier, you have to take insulin every day as prescribed by the doctor. If you have type 2 diabetes, you need to take medication and or insulin as prescribed by a doctor. And many doctors also recommend a change in lifestyle. But if you have pre-diabetes, where you don't have diabetes yet, then they would recommend you change your lifestyle to prevent your body from progressing from pre-diabetes to type 2 diabetes. And as always, prevention is key. So let's say you already have diabetes. What are some ways we can manage it? So the first one would be to maintain your glucose levels as close to the normal range as possible. That you can get from the pharmacy or online. You can get a diabetes monitor where you would have a small machine. It's literally palm size, and then you would prick your finger. Then you would have the special strip that you can put the blood on and test it to check your blood sugar levels. It's called a glucose monitor. Or there is another type of monitor called a continuous glucose monitor, where a tiny sensor is inserted under the skin and you are able to review your results anytime throughout the day. But that one, obviously, you'd need to consult your doctor for this kind of option. Another point of management would be to follow a diet plan. 2 diets are recommended. The Mediterranean diet, which is rich in vegetables, whole grains, beans, fruits, healthy fats, and low sugar, as well as the DASH diet, which stands for Dietary Approach to Stop Hypertension, which is a diet that has an increased level of potassium and has, as the Mediterranean diet, increased fruits, vegetables, whole grains, nuts, seeds, legumes, and low-fat dairy products. And you would also minimize fatty meats, full-fat dairy, and sodium. So I think regardless of whatever diet you follow or whatever diet it is named, the thing that you would have in common is you'd have to increase your fruits, increase your vegetables, whole grains, nuts, seeds, legumes, and low-fat dairy products. Obviously, the next one would be to take your medicine as prescribed, increase your activity level, maintain your blood cholesterol, so your HDLs, your LDLs, and triglycerides, and to control your blood pressure. So control sodium intake, control your stress, or manage your stress with however it is, meditate, take a walk, take a few seconds to breathe. So how can we prevent diabetes? Well, as I mentioned, there are 2 types. So type 1 cannot be prevented as it is an autoimmune disease with possible genetic factors. So if you have been diagnosed with type 1, there isn't really any way you can prevent it. For type 2, as I mentioned earlier, it is also known as a lifestyle diabetes. So you would need to make changes to your lifestyle. So as I mentioned earlier, following a healthy diet and regular exercise of at least 30 minutes 5 times a week. So that is all for today. Hopefully we all went over and learned a little bit more about diabetes.